Hello everyone, today we are going to discuss a very important topic as far as our NEET, PG, INI-CT and even your final prof exams is considered, that is congenital heart diseases, right? Congenital heart diseases, the name itself tells you that something related to the heart that is present since birth, congenital, right? So it mainly deals with the structural malformations of the heart, right? We all know the normal anatomy of the heart. We have two ventricles, right ventricle, left ventricle. We have two atria, right atria, left atria, the valves in between them, right? If there is any structural malformation with respect to this normal heart since birth, this would fall under this category, this broad umbrella term of cyanotic heart diseases, right? Now coming to the physiology, the main aim of this video is to explain the physiology with respect to different types of congenital heart diseases, right? If we talk about congenital heart diseases, they are very fairly common. The prevalence is around 6 to 8 per 1,000 live births, right? So congenital heart disease, if I physiologically broadly classify, then I can classify these into cyanotic heart disease and acyanotic heart disease, right? Cyanosis, you all know what do I mean by cyanosis. That means here the baby is looking blue to you. The baby is looking blue, cyanotic, right? And acyanotic means the baby is looking pink. The baby is looking pink, right? Why in these two heart diseases, one side the baby is looking pink and on the other hand the baby is looking blue to you. The baby is looking blue to you, cyanos to you, right? I know that my systemic circulation, my great arteries, aorta, it receives oxygenated blood from the left side of the heart, right? And this oxygenated blood is run through my entire body so that my tissues can utilize the oxygen in that oxygenated blood. But if due to some malformation, my systemic circulation is receiving deoxygenated blood, then that would lead to the cyanosis picture, right? We can better appreciate this through this line diagram, right? This is a plain line diagram telling the anatomy of the heart. I know this is the right side, this is the left side. So my right side receives the deoxygenated blood from the superior vena cava, inferior vena cava into the right atrium, where this deoxygenated blood will go to the right ventricle through this valve, that is the tricuspid valve, and from the right ventricle now my deoxygenated blood goes for oxygenation into the lungs, right, through this artery, that is the pulmonary artery, right? On the other side, after oxygenation, my left side will receive the oxygenated blood. Pulmonary veins carry this oxygenated blood into the left atrium, left ventricle. We have the mitral valve or the bicuspid valve over here, and finally this blood will go into the great vessel aorta, right? And from this aorta only numerous branches will happen and that will circulate this oxygenated blood through my body, right? Now if due to any malformation, let's say there's a shunt, I make a hole over here, I make a hole in between the two atrias. Now what will happen? What physiology would happen? Now I know my left sided pressures are high as compared to the right sided pressures. So what will happen? My blood will go from this high pressure area to the low pressure area. So there will be left to right shunting. So what will happen as a result of this left to right shunting? Some of the oxygenated blood from the left atrium will go into the deoxygenated side, that is the right side, and we all know the blood from this right side goes again for the oxygenation into the lungs, right? So nothing would happen to my systemic circulation per se, right? My body will still receive oxygenated blood. It's just that some of my oxygenated blood is going into the right side, the load on the right side has increased, right? Similarly, if I make a hole over here, what will again happen? Again blood will go from left to the right side, right? Similarly, if I make a channel connecting these two big arteries, aorta and the pulmonary artery, again what will happen? my oxygenated blood will gain access into the pulmonary circulation. In all the three conditions, you can see that my oxygenated blood is shunted towards the right side, and this blood will again go for oxygenation and come back to the left side, right? So this physiology is known as pre-tricuspid or post-tricuspid left to right shunt physiology, right? In this, my systemic circulation is going to receive only oxygenated blood. So what type of heart disease would be there? Cyanotic or acyanotic? My systemic side is getting oxygenated blood only. This is acyanotic heart disease. My baby will stay pink. My baby will stay pink. So 3 congenital heart disease you have seen over here. First is the ASD, that is a hole in between the 2 atria, VSD, and a channel in between the 2 arteries. What is this? This is patent ductus arteriosus, right? So this is the basic physiology of the acyanotic heart disease, pre-tricuspid and post-tricuspid physiology, right? Apart from that, coarctation of aorta would also be under this, right? So now let's come down to the cyanotic heart diseases. Cyanotic heart disease. Broadly, I can classify the cyanotic heart disease as either restrictive type or constrictive type, right? What do I mean by that? I know that my right side of the heart is very important because it takes the deoxygenated blood from my body and sends it to oxygenation to the lungs, right? So if there is some obstruction on the right side, what would happen? Less blood will go for oxygenation, and that would lead to cyanotic heart disease, right? So say tricuspid atresia, pulmonary valve stenosis, all of these would lead to cyanotic heart disease, right? And in this restrictive conditions, what will happen? The pulmonary blood flow would be decreased. So my X-ray would appear plethoric or oligemic. Blood flow is decreased, so the X-ray would be oligemic, right? X-ray would be oligemic, right? Apart from that, the second category would be a single ventricle physiology. Single ventricle physiology means the outlet of the right ventricle and the left ventricle would be same. So there would be mixing of the blood, that is truncus arteriosus, right? Similarly, yet another physiology that is important, that is transposition of the great ventricles, that is transposition of the great arteries, that is parallel circulation physiology. Let's explain this TGA. Let's learn this TGA, transposition of the great arteries. The normal physiology, we all understand. What happens in normal physiology? My oxygenated blood from the lungs come to my left atrium through pulmonary, goes to the left ventricle through my mitral valve, and this goes into aorta through the systemic circulation. From that, my tissues will utilize this oxygen and give back deoxygenated blood into my superior vena cava and inferior vena cava, right? Through this, the blood will go into my right atrium, right ventricle, again back to the lungs through pulmonary arteries, right? Pulmonary veins, right? So what is happening over here? What type of circuit is this? Remember 11-12 standard, we used to study circuits in physics. There used to be series circuit, parallel circuit. So what type of circuit is this? This is definitely a series circuit. But what happens in transposition of great arteries? The great arteries, pulmonary artery and the aorta, have now switched their places. So the pulmonary artery that initially used to come out from the right side will now exit from the left side, and similarly aorta that was initially exiting from the left side will now exit from the right side. So what will happen in this scenario? My oxygenated blood from the lungs through the pulmonary vein will go into the left atrium, left ventricle, and now instead of aorta, here I have pulmonary artery, and I know this pulmonary artery will again go back into the lungs, And what is happening on the right side? My deoxygenated blood from the superior vena cava, inferior vena cava goes into the right atrium, into the right ventricle, into the aorta, and from the aorta tissues will again utilize and shift it back into superior vena cava, inferior vena cava. So here you can appreciate, instead of a single series circuit, I have two parallel circuits going over here, right? The deoxygenated blood traveling through my right side of the heart and the body, and the oxygenated blood traveling through the left side of the heart and the lungs, right? So in this case, what would be the physiology? It is a cyanotic heart disease. My baby would be blue, right? And here for the survival, I would need a connection. I would need some mixing of the blood to happen. This mixing could happen at the level of the atrium, that is through an AST, right? It can happen at the level of the ventricles, that is the VST, or it could also happen at the level of these great vessels, that is PDA, right? So this TGA physiology, isolated TGA can never exist, right? This child would be very toxic, can die soon after birth. We have to have some alternative channels so that this baby can survive. Either sometimes God gives this channel, right? Or sometimes you can temporarily open this channel by giving prostaglandin, right? By giving prostaglandins like prostaglandins E1 analog alprostadil, that will keep this duct open and will help us. Or we can make the artificial channels like making an AST channel or making a VST, right? So that would be the physiology of cyanotic heart disease, right? The details would be discussed in further subsequent videos. This was basically to accustomize you regarding different physiologies that happen in between cyanotic and acyanotic heart disease. Thank you and have a nice day.